First, I would like to ask for your permission to use this video for educational purpose.
Yes, that's okay.
Now, you do love farming, and that is probably one of the hardest work anybody can do.
Yep.
And you had the proper diagnostic, and we noticed you have a sacroiliac disease. Can you describe your pain and your symptoms before the surgery?
It was quite severe when I would feel like my SI joint or whatever was coming apart when I stepped just right or whatever. It was like a 9 or 10 pain.
Was it 9 and 10 every day, every other day? How often did you have that high level of pain?
It was pretty much every day.
Every day.
Towards the end there.
How much did it interfere with your daily activity, with your life, with your work?
Well, it was interfering quite a bit, I think. It was just I was taking a lot of ibuprofen.
Yeah, and we put you through proper diagnostic, and we noticed it is truly something wrong with your sacroiliac joint.
Yep.
And we did the surgery in February.
That's correct.
Okay. Now, as a farmer, again, that's a hard work. How long after the surgery did you go back to work?
I was actually back to work, I'd say within 3 weeks full time.
Okay.
And actually within a week after I had surgery, I plow snow for a living too, and I was I was driving my truck within a week.
No, most importantly, your symptoms, comparing to before the surgery, how were your symptoms after the surgery? How are they now?
They're doing a lot better now. I'd say my pain level at the most is like a 4 to 5.
And that you said with certain activities?
With certain activities.
If
I step wrong or something, I can still feel it.
Yeah, can you describe what else would make your pain worse? Like stepping over things, meaning?
Stepping over things, like a lot of times like around the farm, if I'm stepping over a wagon tongue or something like that.
What about jumping up and down or activities that resemble that?
Anything like that, yeah.
Yeah, and you told
Sometimes I slipped this spring. I was chasing cows. I raised cows. It's not a good idea to chase cows.
Well, obviously you're gonna live, and what you're describing is the hardest work anybody can do.
Yep.
And but you told me as well, if few days you don't do anything, you notice that your symptoms are practically gone or much better.
Right. A lot better if I would rest.
Yeah, and we are just few months after the surgery. Obviously, those symptoms are expected. Your body is talking to you, telling you what to do and what not to do. And I think most of people notice that if they sort of cooperate with their joint, actually they do much better.
That would help.
Yeah.
I'm a bad patient probably for that.
No, you're just trying to live, but you just have to listen to your symptoms, I guess. But even though with your kind of job, even though that just a week after the surgery you went back to plowing, and 3 weeks after the surgery you went back to the full kind of work, you still notice that the sharp pain is gone, and that your symptoms are significantly improved.
They're definitely improved.
Excellent. And I think that is a sort of proof that this entity sacroiliac disease is real, because some people, believe it or not, still dispute that. But you are the proof of that can really make a huge difference in people's life.
Yep, and it was pretty easy to recover after this.
Yeah, and our surgery was barely half an hour procedure. And how long did you stay in the hospital?
I was only in the hospital about 5 hours.
5 hours, okay, so it's a day surgery.
Yeah,
so it's a surgery that truly makes a difference, and it's worth to do. And okay, well, thank you so much for the interview.
All right.
Thank you.